When you have type 2 diabetes, you hear all the time how important it is for you to exercise regularly. But when you have chronic pain, or you've gained weight, or your life is just stressful, how do you make that happen on a regular basis? Hi, I'm Janet Holtz. I specialize in exercise for people with medical conditions like diabetes, but especially for people who are also limited by pain or stress or low motivation. In this video, I will share with you the way to simplify exercising when you have type 2 diabetes. Glucose or blood sugar is what fuels your cells. Diabetes is when that fuel has difficulty getting out of your blood and into cells to be used. The problem with that sugar hanging out in your blood is that sugar is sticky. It sticks to your vessels, which is why diabetes can affect every system in your body. But when you move your body, your cells open up those doorways, bringing more sugar into the cells to be used. It also makes your body more sensitive to its own insulin. So it makes it easier on a longer acting basis to help your body get that sugar out of your blood and into your cells to be used for fuel. So moving is our most natural way to manage blood sugar. So again, that's all great, but how do you use exercise or even just moving more to make sure that you have the best, most time-effective effect on your blood sugars in a way that you can sustain? Well, first, we want to make sure that moving and exercising is not pain or stress producing. As you know, stress and pain both increase blood sugar. If exercising or even thinking about exercising is stress producing and you think, I can't exercise, I don't have time, or I have this pain, or it's just not comfortable, then you're already raising your stress level just by thinking about exercising. So we've got to make sure that exercise feels good in your body, fits your schedule, and is something that will make you feel better rather than more stressed. Rather than having more pain, we want it to lower pain. And so that means not just moving more, but moving mindfully and science-based, the way your body is designed to move well, so that moving feels good. It releases stress tension and it lowers pain and inflammation. There's three ways to use exercise to do that. The first is mindful mobility. That is stretching mindfully. When you stretch, you create a little muscle contraction. That muscle contraction releases muscle tension and helps to lower inflammation. So little mindful stretch breaks throughout the day in a way that your body says thank you is one of the best ways to stay out of chronic stress and to lower inflammation. Then there's also real life strength exercises. So different than like lifting weights or working out muscles, what we're doing is doing real life movements of everyday life. So you get to move with more ease in everyday life with less strain, less chance of back pain and knee pain and neck pain and shoulder pain, but also you're activating more muscle cells. Those muscle cells are what's using your blood sugar. So when you do strength exercises in the right way with a gradual progression up to a level that feels nice and challenging, but not painful or stressful, you are activating this long-acting blood sugar management system. Strength exercises done well are one of the best ways to manage blood sugar in the most time-effective way with many great side effects. And lastly, doing energizing stamina exercise. This is cardiovascular exercise done in a way that gives you energy right away. And it tells your cells to get better at using glucose to produce long-acting energy. That's stamina. So it's not doing high intensity cardiovascular exercise that leaves you feeling exhausted and sore and stressed out. It's doing cardiovascular exercise in a way that meets you where you are, gives you energy now, and is something that lowers your stress level and improves your energy level. So the bottom line is, when you're exercising for well-being, mindfully, science-based, in a way that allows you to listen to your body, lower stress, lower pain, feel better right now, you have the best way to simplify exercising for diabetes. Learn more about exercising for well-being at exercisingwell.com.